The insertion of a temporary venous pacing wire is often an urgent or critical procedure. To ensure correct positioning of the wire, it is usually guided by fluoroscopy, which is often not available close by. The doctor will need the assistance of 2 registered nurses. At least 1 nurse must have the Advanced Life Support accreditation, and 1 nurse must have the knowledge and skill to assist with the procedure. The doctor will discuss and explain the procedure to the patient, and where appropriate, their significant others. Unless it is an emergency, written consent must be obtained. Staffing available to assist during the insertion is limited. Therefore, as much preparation as possible is completed prior to transfer to reduce the amount of time the patient needs to be in fluoroscopy. There are a number of procedures that can be undertaken prior to the patient being transferred. For example, insertion of a percutaneous sheath. A patient who needs temporary pacemaker support will be unstable and have vital signs that are in the red zone on the standard adult general observation chart. To ensure these patients are as safe as possible, it is recommended that the defib pacing pads are placed on the patient before leaving the inpatient unit. Try and ensure that they are positioned so that they are not going to obscure the fluoroscopy imaging. Transfers of critically ill patients can be physiologically stressful for patients and the staff, as patients can deteriorate very quickly. A patient requiring temporary pacing is at particular risk. Continuous cardiac monitoring is required for all patients, ensuring the ECG dots are placed away from the imaging field. Ensure the cardiac monitoring on the life pack is displayed through the ECG leads and not the defib pacing pads. The monitor should also display non-invasive blood pressure and O2 sats, including waveforms and alarms set for the patient. Escorting staff will need to bring a supply of emergency drugs. This may include analgesia, sedation for patients who are being externally paced. It is the responsibility of the registered nurse caring for the patient to ensure that adequate infusion solutions are available for a period of up to 4 hours. Ensure all intravascular lines are secured safely to avoid risk of dislodgement. All equipment required needs to be brought with the patient. Test the batteries and pulse generator and ensure the bridging cable is attached and ready for use. There is a new battery kept in the pacing trolley. Quick reference guides for clinical equipment can be found in the temporary pacing procedure. The patient should only leave the ward once it is confirmed the radiographer and doctor are ready to receive the patient. Ensure the nurse unit manager or after-hours nurse manager knows that you are going to the fluoroscopy suite with a patient and will be absent from the ward.